Situation. So only in those situations I feel that the sinus lift is probably required. But as you can see, Dr. Prithvi's case, 2 or 3 teeth are usually involved. Generally, the patient's preference is immediate replacement of tooth. So this is quite a long waiting period, and of course, subperiosteal implants I do favor it because it is purely dependent on the surgeon's skill. So we need something where the surgeon's skill is more important for the success of the rehabilitation.
Yes. Okay. Dhyneksh is for subperiosteal implants.
Especially, see,
All the techniques developed in implantology is to make these bone grafts less and give a quick solution.
Exactly.
See, if you have all on 6, all on 8, or all on 4, why was it developed? And then what is that? The trefoil technique. I don't know, I've not done it, seen somewhere. Everything is done to give quick results. Imagine a patient having such extensive surgical procedures comparatively, and you might be doing it a local anesthesia, and then having to wait 6 months, 8 months. It's really very tough. Probably your patients are very much listening to you. That's what our patients are a little fast, I guess.
Great, Dhyneksh. Perfect jaws is subperiosteal implants. The case operated by Dr. Dhineksh. So for this we need some special CT scans, CT scans, so we can virtually plan the implants, subperiosteal implants, and then we can operate. They are
Yes.
synonymous.
Yes, this is a patient-specific implants, yes.
Okay. It's like a regular plating.
Regular plating. These are regular plating. Only thing, the design of the implant is made in such a way that these stresses are distributed properly.
Important. If the screw fails, then entire thing is going to fail.
Yeah, that is the problem there.
So in your case, we saw it was cement retained restoration. That's compatible with cement retained. Is there a possibility to do
Yes.
screw retained also?
Yeah.
Okay, that will be better. How expensive to make these subperiosteal implants?
Expenses, we have different labs, you know. Some labs for a full arch, they charge up to 1 lakh, and some others are charging up to about 40,000. Now I heard in Chennai, in a dental college, they invested everything and they are ready to do it for 5,000. That is better. And see, I always project the quality of surgeon, not the brand all the time. It is the surgeon's skill which gives success to any type of treatment, whatever material you have. So it's never the company.
What do you think is the biggest advantage of subperiosteal implants? Is it more sturdy or easy to make?
When you are doing more and more of full mouth cases, slowly you get these complicated cases where there is very little bone. And these patients expect a solution out of you, and you have to be ready. And out of analyzing all these things, I found that this idea was nice. Subperiosteal implants, you know, I was seeing the literature a bit and inquiring about my friends. So a patient who required quite a fast replacement of tooth. That is how I started initially, and it was really effective. So, see, the all on 6 or 8 is designed when there is enough bone everywhere. All on 4 where there is no posterior bone, all on 4. But there is no bone available at all in all the areas. You can think of zygoma or the subperiosteal implants. Otherwise, you should go for extensive grafting. For grafting an entire arch, I think when I was studying, we were seeing that, you know, EM bone grafts of such large dimensions can be kept, and you have to take such a long time for that.
So you want to say it gives a quicker solution for the patient?
Quicker solution. Initially, there were some pitfalls. See, the size, the length of the abutments were right, you know. So I had a problem initially. Now they are making the screw retain processes as well, where you can take all these impressions to the.
Dr. Prithvi, any experience on subperiosteal implants? Would you like to comment on it?
Because when you extend it posteriorly, it goes up to the buttress and a little more also. It is not very thick as we see most of the times, especially in atrophy cases. But we have multiple screw holes, and if you slide it properly and fit it, it fits in perfectly. I did probably I cut off the distance. Because I was not sure. No, I thought it was the wrong, thing which has come to me. I cut it off. But then they taught me again on the other side. So everything has got its own disadvantages and then the prosthesis which you give. It has to be, quite perfect, even if it is type of a denture. It has to be the self-cleansing area and other things. Otherwise, there is more chance of infection. And as I had started doing more and more cases, now what I'm doing is, this has got a lot of smooth surfaces, no? The bars which come and rest on the bridge. So I started grafting above, I started PRF and all those things to avoid